Good morning, everybody. I'm Alfred Atanda, MD. I am a pediatric orthopedic surgeon, and I'm here early in the morning again, trying to share some thoughts and some wisdom. One of the things I wanted to talk about today that I've been noticing a lot in my practice is the idea of how patients gain access to us at the hospital. Mostly when they call and they send text messages and phone messages. One of the issues is the easiest thing to do is to have a non-clinical workforce receive the phone calls, because the traditional thinking is, physicians, surgeons, subspecialists, it's way too expensive and costly to have us at the front lines. But to be honest with you, I really think the opposite is true. I think it's more costly to have people who do a great job, mind you, and are very valuable to the organization. But when you have non-clinical staff being the front line, sometimes I think it creates more problems and more waste, more dissatisfaction amongst patients and providers to the organization as a whole. For example, your typical patient, when they call my office in particular, what they need is me. What they need is my knowledge, my guidance, my expertise. But there's ultimately several layers of individuals and several layers of people that the person has to go through. And invariably, they may not even ultimately get to me. They may get to one of my designees, one of my physician assistants, nurse practitioners, maybe an athletic trainer. And again, I'm not trying to disparage them. I can't do my job without them. But I think creating an infrastructure where people can get to me directly may prove actually cheaper and may be beneficial to the system as a whole. So what I mean by this is, from a patient perspective, when you call and you're frustrated or you're scared or you're nervous, or you just need information, and somebody who picks up the phone who ultimately can't help you because they're kind of my front lines, that creates a little bit of angst for the patient for the most part. There's a lot of uncertainty, a lot of anxiety, and the patients often have a lot of particular problems and scenarios that they need worked out that I can solve in about 30 seconds. But when you have somebody, receiving that information, and there's like a chain of command and communication before it gets to me, oftentimes the visit purpose and the patient's problem gets very distorted. And then I receive information that may not be most accurate, and then I'm required to make a clinical decision based on that. So my thought is, well, what if I picked up the phone? I would be able to sort people out in 30 seconds to a minute. I'd be able to even provide some clinical guidance, some advice over the phone. Heck, there may be some people that I can prevent from even having to come to the hospital, because maybe all they do is have a simple question. Maybe they just need some reassurance. Maybe they saw another doctor and that doctor said something that they weren't sure about and they needed some clarification. Now that goes against the whole fee-for-service model, because the more people that come to the hospital, the more revenue you can generate, and I do understand that. But when we do eventually see people and we don't know exactly why they're there until they're there in front of us, when we see people who sometimes we can't ultimately help, when we see people who have expectations that we can't meet, that creates a whole nother problem. Because now, as a provider, I'm seeing a patient that may not be an ideal patient for me. I'm seeing somebody that I can't help instead of somebody that I could potentially help. And as a surgeon, I may be seeing somebody who doesn't even need surgery, and they're taking up a slot and time of a patient who actually may need surgery. So that creates a lot of frustrations for providers, not having that control. And in my mind, I actually traditionally prefer to have, non-clinical staff answering the phone, so I can quote unquote use my time more efficiently and effectively. But by being so far removed from that initial intake process and from the front lines, I'm invariably shooting myself in the foot most times, because now I'm seeing people who I need to triage and sift through, when I could have actually triaged them up front and created a system and a filter where I can see the patients that I only need to see, and then I can, triage and have other providers see patients, or maybe, like I said, not even have people seen at all. And I think, part of those frustrations as a provider, then I take those to my organization. I take those to my administrators. I take those to my hospital system, and it creates more work for them, right? Now we have to have meetings and huddles and talk about some of these frustrations and problems that we have as providers, which takes up time, which takes up resources, and it takes the administrators and the system away from their job and what they need to do. So it kind of creates this never-ending cycle, and I think it behooves us, as we move into the digital age and times of health innovation, times of digital medicine, telemedicine, artificial intelligence, we need to figure out ways to get the knowledge that we have swirling around in our heads straight to the people when they need it the most, when they call. And I know that's a big culture shock, but what I've been doing, and what I recommend some of you physician innovators out there to do, is to think about how you can put yourself on the front line. I know it does take energy, I know it does take time, and it does move away from what you've traditionally been taught. But I think the downstream effect is far more positive and beneficial by getting people what they need at the initial point of contact, because it creates more problems eventually for us when we separate ourselves from the patients. And I think as we move into this digital age and we see large corporations and other folks entering the healthcare space, I think these are the things that they're going to do to sell themselves to the public. And traditional hospital systems and doctors and so forth are going to have their work cut out for them to be able to compete with the future of how healthcare is delivered. So next time you're in the clinic and you have some free time, maybe think about hanging out with your schedulers for a little bit. I've done that in the past to get a glimpse of what they do, the kind of calls they get, the kind of things they have to deal with. You may find that a lot of those problems could be solved very quickly with very minimal effort on your part. And then the schedulers can be there to schedule patients. And I think that's ultimately what they're really good at and what we need them to do. I would never suggest that doctors sit there and schedule people physically, but triaging and sifting through the patients and providing that clinical experience and guidance is of utmost importance, And even though non-clinical folks may be cheaper and easier to put in those roles, I don't think that's ultimately what's best for the patient, the provider, and the system as a whole. So I hope you enjoyed that. I hope you enjoy the beautiful morning behind me in the backdrop. It's time to go back to work as usual. And hopefully you'll join me next time. Have a good day.